the mental health matters affecting you and your community at large, the warning signs and also the common symptoms that we know about mental health, and where should people seek support. So stay with us as we get into the details. Now, Ebola toll deaths in Democratic Republic of Congo reaches 600 as the response efforts continue to intensify. Now, the Ebola outbreak in the Democratic Republic of Congo has reached a grim milestone, with the number of confirmed deaths rising to 600 as health authorities and international partners continue efforts to contain the deadly virus. Now, according to the latest figures released by the World Health Organization, the outbreak has so far reached 1,759 confirmed cases since it was officially declared in the mid-May this year. Now, health officials say that the disease continues to spread in the parts of the northern Eastern Democratic Republic of Congo, despite the ongoing response efforts. Now, the World Health Organization reports that the outbreak has claimed 600 lives, representing a case fatality rate of approximately 34%. Now, while hundreds of people have recovered, health officials say that the outbreak remains active, with new infections coming in and continuing to be detected. Now, the current figures indicate that 285 patients have recovered from the disease, offering hope that early diagnosis, supportive treatment, and timely treatment and medical care can improve survival. However, another 304 suspected Ebola cases remain under investigation as the health teams continue laboratory testing and contact tracing. Now, the outbreak is largely concentrated in the Ituri province, although confirmed cases have been reported in the 3 other provinces, increasing the concern about the further spread of this disease and it being transmitted so quickly. So the current outbreak is being considered and caused by the Bundibugyo strain of Ebola virus, a rare species for which there are currently no approved vaccines or specific treatment for the disease. And this has made controlling the outbreak more challenging compared to the previous Ebola outbreaks where the licensed vaccines were available. Now, to improve the patient outcomes, the Congolese health authorities, working together with the World Health Organization and the international research partners, recently launched clinical trials to elevate 2 potential treatments for patients infected with the Bundibugyo strain. Now, the trial is assessing the effectiveness of the monoclonal antibody treatment, also known as MBP 134, and the antiviral medicine, and researchers are testing for these medicines individually as well as in the combination to determine whether they can reduce the deaths or improve or show recovery among the Ebola patients. Now, health experts said that the result of the study could provide important evidence for managing future outbreaks caused by the Bundibugyo virus and strengthen the global preparedness against the emerging infectious diseases. Now, meanwhile, the neighboring Uganda continues to maintain the heightened surveillance and preparedness following cross-border cases linked to the Ebola outbreak. Now, according to the World Health Organization, Uganda has so far recorded 20 confirmed Ebola cases associated with the outbreak, including 2 deaths, and 17 patients have successfully recovered after receiving the treatment and have since been discharged from the care. Now, the Ministry of Health in Uganda has continued to strengthen screening at border points and enhance disease surveillance, monitored the contacts, and conducted community awareness campaigns in districts considered to be in high risk because of the frequent movement across the Uganda-DRC Congo border. Now, the World Health Organization says that Ebola is being transmitted through a direct contact with blood and bodily fluids or tissues of an infected person or contaminated materials, and early symptoms including fever, a severe headache and muscle pain, weakness, vomiting and diarrhea, whilst the severe cases can progress to internal and external bleeding. Now, health experts continue to urge the communities at large in the affected areas to report the suspected cases immediately and avoid contact with infected persons and cooperate with the health workers conducting surveillance and contact tracing. Now, the World Health Organization, together with the government of the Democratic Republic of Congo and Uganda, says that coordinated regional action remains essential to stopping transmission, protecting the vulnerable communities, and preventing the outbreak from spreading further across the national borders. Now, from that story, moving on to our next story for today. Now, the Ministry of Health hold a strategic retreat to strengthen the leadership and review Ebola responses. Now, the Ministry of Health Uganda has commemorates a 3-day management retreat aimed at strengthening leadership and reviewing Uganda's response to the ongoing Ebola outbreak and setting priorities with a guidelines to the country's health sector over the next 5 years starting. Now, the retreat brings together the ministry top leaders to reflect on the current state of the health sector, assessing progress made in delivering healthcare services, and develop a shared strategic direction for the improving health outcomes across Uganda. Now, according to the Ministry of Health, this retreat is intended to orient the senior managers of the ministry's long-term vision while strengthening strengthening the coordination, teamwork, and collaboration among the departmental leaders responsible for implementing national health programs. A key focus of the meeting is Uganda's ongoing preparedness and response to the Ebola outbreak linked to the neighboring country, which is Democratic Republic of Congo, and health officials are receiving the country's surveillance systems and cross-border coordination plus case management, laboratory capacity and community engagement to identify the lessons learned and strengthen the future responses for the emergencies. Now, the discussions are also examining the stakeholder management, recognizing the important role played by the development partners, local governments, health workers, civil society organizations, and communities in supporting the disease prevention and improving healthcare delivery. Now, the ministry says that effective collaboration with other partners has been instrumental in strengthening Uganda's healthcare system, and particularly in responding to the public health emergencies and expanding immunization programs and improving maternal and child health services. So during the retreat, the participants are expected to evaluate the implementation of the existing health sector priorities while identifying areas that require greater investment and policy attention over the next 5 years. Now, this includes strengthening the primary healthcare system and improving access to quality healthcare services, increasing the healthcare workforce and expanding digital health systems, and improving disease surveillance, enhancing emergency preparedness and response, and accelerating progress towards the universal health coverage of Uganda at large. Now, health officials are also expected to discuss strategies for improving accountability, service delivery, resource mobilization, and performance management across the health sector to ensure Ugandans receive timely and quality healthcare services. Now, the retreat comes at a time when the Ministry of Health continues to implement several priority programs, including the fight against HIV, tuberculosis, and the neglected tropical diseases, while responding to the emergency public health threats such as Ebola and Mpox. It also follows continued government investment in health infrastructure, including the construction and upgrading of the hospitals, expansion of oxygen plants, strengthening intensive care services, and increasing specialized healthcare services across the country. Now, officials say that the retreat will also strengthen communication and teamwork among the senior managers, enabling the ministry to respond more effectively to the emerging health challenges while delivering people-centered healthcare services. Now, the Ministry of Health says that the outcomes of the retreat will help shape the strategic discussions and decisions and guide the implementation of the priority health interventions over the next 5 years, with the overall goal of building a more resilient, responsive, sustainable health system for all Ugandans at large. Now, from that story, moving on to our stories from the WHO. Now, the WHO warns global cancer cases could nearly double by 2050 without urgent action. Now, the World Health Organization is warning that the number of new cases for cancer worldwide could nearly double by the year 2050 unless governments take action to strengthen the cancer prevention, early detection, and access to the treatment. Now, the warning is contained in by the WHO's Global Status Report on Cancer 2026, recently jointly with the International Agency for Research on Cancer, which plants and paints a concerning picture of the global growing burden of this disease. Now, according to the report, cancer remains the second leading cause of death worldwide after the cardiovascular diseases. Every year, an estimated 20.6 million people are diagnosed with cancer, while nearly 10 million people die from the disease on average. Cancer claims more than 26,000 lives every single day, and this is worldwide. Now, this report warns that if the current trends continue, the number of new cases will rise to nearly 35 million annually by the year 2050, placing enormous pressure on the health systems, economics, and the families around the world. Now, the World Health Organization says that revising this trend will require countries to adopt to a people-centered approach that focuses on not only on the treatment but also prevention, early diagnosis, quality health care, and support for the patients and their families. Now, the WHO's Director General, Dr. Tedros, says that cancer affects nearly every family at some point in life, either through a personal diagnosis or that of a loved one. He says that a person's chances of surviving cancer should never depend on whether they are born or how much money they can earn, noting that these inequalities heightened in the report are preventable through stronger political commitment and increased investment in healthcare. So the report reveals significant differences in cancer survival rates between wealthy and low-income countries. For an example, 87% of women diagnosed with breast cancer survive for at least 5 years after diagnosis in high-income countries, compared to only 42% in low-income countries, where access to diagnosis, treatment, and specialized care remains limited. Now, this report also shows that fewer than 1 in 3 countries currently include a comprehensive cancer care without their universal health coverage programs, leaving millions of patients without affordable access to life-saving treatment. And beyond the health impact, the report heightens the heavy financial and emotional burden experienced by the cancer patients and their families. Now, according to the WHO's first global survey of people living with the cancer, at least 45% of the patients experienced the financial hardship during treatment, while more than half report mental challenges resulting from this disease. So the survey also found that the caregivers often experience emotional stress, social isolation and financial strain while providing unpaid care to their loved ones. So globally, Asia continues to carry the largest cancer burden, accounting for more than half of all new cancer cases and deaths because of its large population. From Asia, Europe, despite representing only about 9% of the world's population, it accounts for more than 1/5 of the global cases, while many African countries continue to record lower numbers of the cases but significantly higher death rates due to the delayed diagnosis of the people and limited access to treatment. So this report identifies lung cancer as the leading cause of cancer-related deaths worldwide. So among men, lung and prostate plus colorectal cancers remain the most commonly diagnosed, while breast, lung, and colorectal cancers are the leading cancers affecting the women. Now, health experts say that nearly 4 out of every 10 cancer cases are linked to the preventable risks. And these include tobacco use, excessive alcohol consumption, obesity, unhealthy diets, physical inactivity, air pollution, and infections such as human papillomavirus, hepatitis B, hepatitis C, and Helicobacter pylori. So the World Health Organization notes that several countries have made important progress in reducing the cancer risk through stronger tobacco control policies, expanded vaccination programs, and improved infection prevention measures. And since 2010, global tobacco use was declared by 27%, contributing to the reductions in the lung cancers in the several countries. The report also highlights the growing political commitment, with 82% of the countries now having national cancer control plans compared to just 50% in 2010. So despite the achievements, WHO says that the major gaps remain in access to the essential cancer medicines. Now, the World Health Organization says that the decisions governments make today will determine the future of the global burden for cancer, emphasizing that sustained investment, stronger prevention programs, and equitable healthcare systems will be critical in reducing cancer deaths and improving survival rates for millions of people around the world. Now, moving on from that story that is highly concerning to another story coming in still from WHO. Now, WHO joins a new global digital health initiative to strengthen healthcare systems around the world. So the World Health Organization has joined the newly established Open Health Software Foundation, a global initiative aimed at helping countries build stronger and more connected to sustainable digital health systems. So the foundation, established by the Linux Foundation with support from the World Health Organization, Google, and several international health and technology partners, seeks to address one of the biggest challenges facing healthcare systems worldwide: and fragmented digital health platforms that are unable to communicate with each other. Now, according to the WHO, many countries have developed separate digital systems for programs such as immunization, HIV, maternal health, and disease surveillance. And because of these systems often operate independently, health workers are forced to enter the same patient information multiple times, while governments struggle to obtain a complete picture of their national health systems. Now, WHO says that the new Open Health Software Foundation will promote the development of open source digital tools that allow different health information systems to work together, improving the efficiency, reducing duplication, and supporting better patient care. Now, this initiative builds on a collaboration that began in 2020 when WHO partnered with Google to make its clinical and public health guidance easier to integrate into the digital health systems using internationally recognized standards. Now, this collaboration later evolved into the Open Health Stock project, which was launched in 2023 and has since supported digital health programs serving millions of people across countries in the sub-Saharan Africa, South Asia, and Southeast Asia. Now, the WHO says that these digital tools developed by the foundation are built using internationally recognized standards for exchanging health information and international classification of the diseases, which is ICD, allowing patient data to be safely shared and constantly between different health systems. So the organization believes that this initiative will help countries move towards a more resilient digital health infrastructure by reducing dependency on expensive software and internal technology providers. So the foundation will also support the responsible use of artificial intelligence in healthcare through a new program commonly known as AI Commons for Global Health. Now, the program will develop the shared tools, technical standards, and evaluation systems to ensure artificial intelligence technologies introduced into healthcare are safe, transparent, interior, and consistent within the WHO's recommendation. Now, speaking during the development, WHO's head of digital health and information systems, Dr. Gareth Mahel, said that many promising digital health projects have failed after donor funding ended because countries lack ownership of the underlying technology. He said that sustainable digital health systems require governments to control both the governance and technical foundations of their healthcare infrastructure, reducing long-term dependency on external vendors. Now, the WHO says that the Open Health Stock Software Foundation provides countries with an opportunity to strengthen local technical capacity by allowing the government agencies, universities, non-profitable organizations, and local software developers to contribute directly to the platform and adapt to their own healthcare needs. Now, WHO says that this initiative marks an important step towards building stronger, more resilient, and good digital health systems capable of improving healthcare delivery, strengthening disease surveillance, and supporting universal health coverage across the world. Now, the organization believes that by embracing open standards, local innovation, and country ownership, governments will be better positioned to build modern healthcare systems that are sustainable, affordable, and able to meet the future public health challenges. Now, to our dear viewers, that brings us to the end of today's Your Health Updates. Coming in next is an expert discussion on mental health, where we are going to go beyond the headlines and explain and examine one of the most important aspects of the overall well-being. So, our presenter for First of Mental Health, Mrs. Sozi Becky, will help you understand and recognize when to seek help and supporting family members, friends and communities and colleagues who may be struggling with mental health issues. And she will share practical advice on protecting your mental health and your well-being. So stay with us here on TV1. The conversation continues after the short break.
A new beginning and a new day. We bring you the news that matters when it matters. From international headlines to the stories shaping our communities at home.
Because where is my ocean? I'm entitled to that ocean.
With expert analysis, in-depth conversations, and deep dives into the issues behind the headlines, we don't just tell you the news, we break it down. Start your mornings informed, prepared, and ahead of the day. New day, clear news, real insight, a smarter start. Weekdays, 6:30 a.m. to 9 a.m. only on TV1.